Greetings, people of tomorrow. See a need, take a lead. Welcome to another episode of On Call 36 podcast. And today we are honored to have Dr. Suba in our room to talk about the metabolic health and also how to tackle the syndrome. So, Doctor, maybe can you introduce yourself to the audience?
Okay. Firstly, I would like to thank AMSA UTAR for inviting me to the podcast. Okay, to present on this very important topic. I'm Dr. Subashini. My full name is Dr. Subashini Chellappah Thambiah. So just stick to Dr. Subashini.
Right.
Okay. And I'm actually a consultant chemical pathologist. I practiced at Hospital Sultan Abdul, Aziz Shah at UPM. I'm also an associate professor there. And I'm also the president of the chapter of chemical pathology and metabolic medicine under the College of Pathologists. So, and my areas of interest is actually, ironically, lipids and bone disorders. So metabolic syndrome is one of my
one of your subjects.
favorite topics lah.
So favorite topics.
Yeah.
All right. Thanks, Doctor, for the wonderful introduction. And from our side, we also would like to thank you for joining us, for making time to join us for the podcast, and we are really pleasured to have you in our room today. So, Doctor, shall we dive into the topic today?
Sure.
Yeah, maybe, Doctor, can you share some insights on what actually is metabolic syndrome?
Okay, now before I go into what is metabolic syndrome, I think we need to understand what is a syndrome.
Okay.
So now a syndrome is basically a set or a cluster of components, okay, that give rise, we just put it all together and gives rise to a particular, what we call a syndrome. Okay, and this word syndrome actually comes from a Greek word. Metabolic syndrome, it comes from a Greek word and it means concurrence. Okay, so they all correlate with each other to give you a specific disorder. Okay, but when that syndrome has a cause, then it's known as a disease. Alright, so coming back to your question, metabolic syndrome is a cluster of components. And what are these components? So we've got anthropometric measurements, which like your waist circumference. Okay, so fat around your body waist. Okay, your blood pressure, your lipid levels. Okay, there's 5 criteria. Okay, but your lipid levels, they divide it into 2 lah. Your triglycerides and your good cholesterol, HDL, high density lipoprotein cholesterol. And lastly is your blood glucose levels. So taking these 5 criteria into account, okay, depending what the cutoffs are, it gives you metabolic syndrome.
So basically, metabolic syndrome covers high triglycerols,
Yes.
and then low good lipids.
Low good lipids.
Low
yes.
good lipids, high blood
High
sugar,
High blood pressure.
high blood pressure,
Yes.
and also what are the 2 is high blood sugar, is it?
Correct.
And the last one is
Waist circumference.
waist circumference.
Yeah,
Alright,
increase
okay.
waist circumference.
Increase in waist circumference. So maybe, Doctor, what are the signs and symptoms like? Besides this one, is there any when the patient come in, what are the signs and symptoms that we can see on the patients or when they have
Okay,
metabolic
so
syndrome?
now for the first of all, for the patient to come and see the doctor, okay, they must feel something. Okay, actually there's a criteria. There's a criteria for metabolic syndrome. I'll go into that a bit later.
Okay.
But I think generally if a person is feeling unwell, you're feeling extra lethargic, you're not feeling well, you're having headache, giddiness, neck pain, because all these are signs of high blood pressure. Okay, maybe you're drinking too much, what we call polydipsia, okay, or you're passing a lot of urine, polyuria, and then going to the toilet at night, what we call nocturia. So these kind of things, again, is your sugar levels high, and then are you putting on weight around your belly area? Okay, all of us got a big belly lah as you grow older, but that doesn't mean everybody with a big belly has metabolic syndrome. Okay, so these are the things that we look at, and in terms of the actual criteria, you'll have to do a blood test. So you go in to see your doctor. Okay, you go in to see your doctor, and then you say all this. So the first thing the doctor will say is, look, let's do a blood test. Okay, first take your blood pressure. Okay, and then maybe measure your waist circumference. Rarely it's done, but then I think if they are suspecting metabolic syndrome, they have to do all this. Okay. Would you like me to go into the actual criteria for metabolic syndrome?
Sure. If Doctor would feel like to share. Also.
Okay, so now this is a bit medical, a bit technical. I'll try to go a bit slow. Okay, actually metabolic syndrome, there are various definitions. Okay, it started in 1998, World Health Organization. Okay, they started. Then there's another group, NCEP, ATP3. They are in charge of lipids, actually, this lipidemia criteria. in 2001, they have a different criteria. Okay, then in 2005 you got International Diabetes Federation. So all these different societies, they've come up with different criteria. Okay, and it's basically, it boils down to your sugar levels are not normal, hyperinsulinemia. Okay, that means high insulin in your blood, and your lipid levels are deranged. Okay, so what happened is another 6 authorities. Okay, another 6 authorities. 3 out of it I can remember. Okay, International Atherosclerosis Society. There's an Obesity Society. There was an American Heart Association. Okay, among the 6, and they came up with this another criterion known as Joint Interim Statement, and this was in 2009. Okay, now what is this Joint Interim Statement? Basically, it harmonizes all these different criteria, so makes it easier for everybody, and it's consistent clinical care for the patient who presents with metabolic syndrome. So now it is used worldwide, and it's actually one of the some places still may use the old ones, but most of us use the GIS criteria. Okay, so now, would you want me to say what GIS is?
Yeah, sure.
Okay.
Yeah.
Okay, so you are asking me, so how would the doctor know that you have metabolic syndrome?
Yeah.
Okay, so if I'm going to be using this GIS criteria, it's got 5 criteria, out of which we take 3.
Oh,
Okay,
that means
so if 3 out of 5, we say you have metabolic syndrome. Okay, if you fulfill 3 out of 5. Okay, so waist circumference. Okay, so for females, if it's more or equal to 80 cm, and for males, more or equal to 90 cm. Okay, so we say that you've got metabolic syndrome. Okay, sorry, I think it's the other way around.
Other way around.
Yes, I think it's the other way around.
Female is 90.
Correct.
Oh, correct. Okay.
Females are more equal to 80 cm, males is more equal to 90 cm.
Okay.
Yes, okay. Because females are more prone to these disorders because of their hormonal imbalance, menopause, so they give you a tighter range. Okay, 80 cm. Blood pressure, your systolic blood pressure more equal to 130. Your diastolic blood pressure more equal to 85. Okay. Now lipids, your triglyceride more equal to 1.7 millimoles per liter. Your HDL, male and female different also. Okay. Females 1.3, males 1 millimoles per liter. Okay. And lastly, it's blood glucose. Now blood glucose, you have to be a bit careful because it's not just diabetes. Okay, there's another condition known as pre-diabetes.
Yeah.
Okay, I think you've heard about this recently. There's a big thing about pre-diabetes.
Yes.
We have a national launch on it actually. So under pre-diabetes, you got impaired fasting glucose and impaired glucose tolerance. So this you have to be very careful, and you have to explain to patients, because patients with pre-diabetes have a higher risk of cardiovascular disease, and they can also go to type 2 diabetes. So those cutoff values, the doctor should know for each one.
So basically, there are like a lot of things when patients start to feel like lethargic, and the signs and symptoms are basically the outcomes of what they have, like high blood glucose. Then what are the signs and symptoms of high blood glucose?
Correct.
So it's like a collection of different disorders that leads to metabolic syndrome, signs and symptoms.
So it's not just one thing.
Yeah. So it's like actually it's like now that we know that metabolic syndrome is actually quite a big topic, and it includes like high blood glucose and also high lipids, and also like increase in waist circumference. Yeah, and based on these things, how does it actually differs to other health conditions like maybe obesity or diabetes?
Okay, because so that brings me to basically what you've just said. It's not just one thing. See, having metabolic syndrome actually increases your risk of having type 2 diabetes. Because remember, I just told you, part of the criteria, not necessarily you have to have diabetes. You can just have deranged sugar levels, like impaired glucose tolerance or impaired fasting glucose. So, firstly, it can increase your risk of type 2 diabetes. And being obese is part of, predisposes you to metabolic syndrome. Why do we do waist circumference? Because that's where the insulin resistance builds up. That's why they call it visceral fat, very stubborn fat. You can be fat everywhere else, but if your abdominal fat is high, that is the danger. It gives rise to insulin resistance. Okay, so your question, how does it differ? With type 2 diabetes, there are certain medications to treat it. Whereas in metabolic syndrome, I don't have one medication that can treat metabolic syndrome. I have to have like 3 different medications maybe, plus lifestyle factors are very, very important. So,
Yeah, so like for metabolic syndrome, they is differ based on what kind of what are the patients are having. Like if they have high blood glucose, then what are the management on different type of managements for metabolic syndrome. Whereas like diabetes, then you know what diabetes medication are given, right? All right, good. Then about metabolic syndrome, how common is it in Malaysia? Like we know that Malaysia is like one of the most obese country in Asia. Like how is it?
Yes.
How about metabolic syndrome?
Okay, yes. You're right. Okay, so the trend is an upward trend. Actually, it's rising, and this is similar to all other countries, lah. Okay, it's going up. It's very concerning. Okay, and the prevalence is about from previous studies, local studies, it's between 25% to 40%.
Oh,
So it's quite high,
Quite high.
and it's still on the rise. Okay, and see, I can't give you one figure for the percentage. I'm giving you a range because it depends. The studies that were done, it's actually quite old. Current statistics, we don't really have. I did a recent study in 2018, 2019. I got 39.9%. But I based my study on the JIS criteria, and I have a certain population that maybe in one hospital. It's not multi-center. So you see, what you need to understand it with prevalence, it's not just taking the prevalence and saying, oh, this reflects Malaysian population. No, you must know which population it takes into account. And in Malaysia, we have multi-ethnic population.
yes, I agree.
So you got Malay, Chinese, Indian. Okay, each of us eat differently and we do different things. Okay, gender. Okay, so that's why you got different cutoff values for HDL and also waist circumference. So if people don't take that into account when they're talking about metabolic syndrome, your prevalence can change a bit. Okay, age is another thing, and then the other thing is which criteria you used. So if say the older studies, maybe they used the WHO criteria or something. So if everybody used the same criteria, then maybe we can get 1%. So a lot of factors affect the prevalence. But generally, it's between 25 to 40%.
But it's still rising in our
yes,
country.
yes.
Oh, I see. And I think will be very alarming for our government from the healthcare side then to take note on this, because if everyone have obesity or they have
Correct.
metabolic syndrome,
Yes.
then there's a lot of complication that rises from there and will be a burden for the general hospital,
Yes.
government hospital to take care of these patients. Now speaking of this, since we are talking about like the prevalence and also the risk, and doctor, is there any like ways that we can prevent metabolic syndrome? Because we always say, as doctor, we always help a patient that prevent is better than cure. So
Correct, yes.
So I would like to let the audience know what actually the other ways that
Okay.
can overcome metabolic syndrome.
Like I mentioned earlier, okay, with metabolic syndrome, the cornerstone of management is lifestyle changes. Okay, it's actually our lifestyle, and with the COVID, everybody was happily Grab. Correct? Grab food, isn't it? Everything was Grab food. So it's always outside food. I mean, even today, if I walk out, even just now, I was just looking at it, everybody is in every shop eating. Nobody cooks in the house anymore. Everybody is buying outside food, which is not healthy. Okay, so, and then urbanization. We all live in an urban area.
Areas.
If you compare the health of urban population with the rural population, it's very different. Rural, they are more active. They go into the farms, whatever they're doing, they don't have fancy cars to go up and down. They're exposed to sunlight. Vitamin D deficiency is also correlated with type 2 diabetes, with cancers, with everything. So urbanization is one. The other thing is sedentary lifestyle, no physical activity. Okay, I'll take myself as an example. I get up in the morning, I step into my car, nice and aircon, go to work, I'm there 8 to 12 hours, come back, I got time to do anything else, So you don't do exercise. Then you eat all sorts of rubbish.
Junk foods.
Yeah, you don't eat home cooked food. You are eating. If you say prevent, I think it starts from there. You need to maintain a healthy lifestyle, and even if you have not all this while, you can still change. And if you change for the better, these levels can go down. you can reverse the components within it. Yes, you may be started on medication, you may not be started on medication, but sometimes if you're started on medication and you still continue your lifestyle as it is, it's not going to make a difference. It's going to be very difficult to control the disease. And what the doctor is going to do, keep increasing your dosage of your medicine.
Because the numbers it's not going down.
And the other component is also stress. Stress, lack of sleep, all this contributes to metabolic syndrome. Because stress, lack of sleep, they affect certain hormones in your body. Okay, there's a particular hormone known as cortisol.
Yeah.
Okay, and cortisol is from the brain. It's from your adrenal gland, but it's affected by your another hormone in the brain. And I don't know whether you know the concept of diurnal variation. That means these hormones change during the day. Okay, they are highest in the morning and then they go down towards at night. Okay, so if you don't sleep well, or even shift workers, people who work, this hormone is going to get confused. When am I supposed to go up? When am I supposed to go down? And stress. It's also affected by stress. And cortisol is important for glucose metabolism. It works opposite to insulin. So a lot of factors, but people don't realize that. They think, no lah, I don't know why I got glucose. Okay, the other thing that poor things they cannot control is genetics lah. Okay, so if your parents have diabetes or blood pressure, that's all the more reason for you to go for health screening earlier and make sure that you're on the right track, and also make sure that your lifestyle is intact lah.
So basically, like what we need to do is to take care of ourselves to prevent the metabolic syndrome, because metabolic syndrome is not actually from one cause. It's multifactorial.
Correct.
Where every like diets, exercise, and lifestyle management plays into role and to keep us healthy and prevent us from getting metabolic syndrome, right?
Yeah.
So is there any, like, what is the usual advice you would give to your patient, or if you give to someone who are at risk for metabolic syndrome, like maybe from the side of diet?
Okay, so to be more specific, when you talk about diet, you talk about refined carbohydrates and saturated fats. Bad. Okay, so what is refined carbohydrates? It's processed food where they strip that carbohydrate from all that grains and vitamins, minerals, everything is removed from it. Okay, so what are examples of refined carbohydrates? Your white bread, your everything that we like lah. Okay, everything white. Okay, white bread, white rice, your cakes, your cookies, your cereals. Even they have so many cereals in the market telling you it's good for this, but it's full of sugar. So anything with high sugar content, refined carbohydrates. So what is not whole carbohydrates is your whole grains. Like your barley, oats, everything doesn't taste very nice. I don't like all that, but it's good for you. So I'm not saying that you don't eat refined carbohydrates at all. Occasionally it's okay, but maybe balance it out. Okay, a balanced diet, and then of course fruits, vegetables. Processed meat is also bad. A lot of processed meat, sausage, bacon. Okay, so this brings me to the topic of fats. Okay, so you got your carbohydrates one side, your fats, saturated versus unsaturated fats. Okay, so your saturated fats are, if chemically you want to think scientifically what is saturated, they have no chemical bond between them. Okay, and they at room temperature they are solids. Okay, so coconut oil, like I said, all this meat, processed meats, not good. Okay, whereas unsaturated fats, they got mono, and I'm sure you've read when you go,
monosaturated,
what does it mean?
Trans fat.
So mono unsaturated versus poly unsaturated. Both are okay. One is one bond, poly means many bonds lah. Okay, and they are liquid at room temperature. Okay, and they are like your fatty fish they call it, mackerel, salmon, all these are good. Okay, seeds, flaxseed, sunflower seeds. So these are things that are good. And then oil, I think it is olive oil. One more oil, I can't remember. Anyway, okay. So, but you can Google Okay, all these are there. So, but doesn't mean I said you can eat unsaturated fats. You go nicely indulge in unsaturated fats. No, okay, because with anything there must be moderation. So yes, you can take it, but don't take too much because it is also dangerous. It's still fat one. So that's one. So diet is that. The other side, you've got your physical activity. So aerobics is good. Strength training, because that will it will increase your insulin sensitivity.
Oh,
Exercise
alright.
increases your insulin sensitivity. So that is good. And of course, you lose weight as well. So that is very good lah. Whereas your diet part is your lipids and your sugar levels.
Sugar levels. Then, Doctor, you got mentioned that fruits and actually, especially on fruits, because what I read on the internet, okay, this one is for clarifying. Like what I read on internet, for those who are have high weight, they want to reduce their weight. Actually, eating a lot of fruits are not going to help them to reduce weight because actually fruits have high sugar levels.
Yeah,
Is it?
some fruits do have high sugar level. Like I said, anything should be done in moderation. It's definitely because you see a lot of people who are meat eaters, they don't like vegetables and they don't like fruits. And you'll see their plate is just filled with a variety of meat. Maybe one small green you'll see there lah. So just to have a balanced diet. I'm sure you've seen that food pyramid.
Yeah, food pyramid.
And actually the biggest is fruits and vegetables. Then it goes higher up in the
About the levels.
Yeah, levels. So, I think so. You can look up again the internet for high sugar content. If you're already diabetic, be careful. But when I say eat fruits, don't go and again overindulge in fruits lah. Yeah. So anything has to have to be in moderation, and but fruits are good for the health because of the vitamins in it. It's natural. It's natural vitamins, so it's definitely good for the for the individual.
So basically, what people should get from here is that to prevent them to get metabolic syndrome, a good lifestyle is the
Correct.
main thing to be done.
Yes.
Okay, then
Very
they have a good diet, balanced diet. I would say balanced diet that filled with maybe sugar levels. We have moderate sugar levels and certain of fats, and get vitamins and minerals. Just everything moderate. Just the right portion, and then get some exercise from daily. Is it necessary for them to daily exercise? Or
You see,
maybe
even if
occasion?
it's 3 times a week for a person who's busy, just go for brisk walking. I mean, if you're old and you're not osteoporotic, okay, we don't expect you to be doing aerobics and jumping up and down. So just as long as you are active, so your metabolic activity is also higher, so you'll be burning your fats and your sugar. So if you're going to sit and do nothing the whole day, it's
it's not going to work.
Yeah, so it helps, like instead of taking medication, to reduce your levels, you're doing something natural to reduce your levels and to lose the weight as well.
So to sum up today, that we learned about metabolic syndrome is actually a collection of different types of disorder, like pre-diabetic. Actually, it's pre-diabetic, right? A patient with high blood sugars, and then high cholesterol, low good lipids, and then big waist circumference, and also one of it is high blood pressure. So it's actually a collection of different disorders together to say that you have a metabolic syndrome, and there are a lot of criteria for doctors. So what the audience can know, that if they always feel lethargy and have symptoms of high blood sugar like polyuria, polydipsia, and they eat a lot, and then they have a build up weight, then have to seek for help for their doctor, then only the doctor will diagnose them from different criteria.
Correct. I mean, the doctor will have to investigate.
Investigate, so they can cannot just okay, so you have this symptoms, cannot, right? So first thing they will do is take your blood and then go for different blood tests to see whether your range of maybe sugar levels are in range or not, right? And after that, for them to prevent getting metabolic syndrome is lifestyle management.
Yeah.
So I think this one is I think the audience would like to know, what we want to emphasize here is for the audience to have good lifestyle management where they control their diet and also get enough physical activities. If they don't have time, at least get a walk, or maybe can have some physical activities at their home.
Yeah, have a treadmill.
Treadmill, because now we got a lot of technology, right? Treadmill, running tracks that can be installed in house. So we encourage them to have this kind of lifestyle management. I think that's what we have learned today about metabolic syndrome.
Can I just add one more?
Oh yeah, sure.
Just basically, why is metabolic syndrome important? Because of the complications that is associated with it. Okay, and the main thing is cardiovascular disease. Okay, when I say cardiovascular disease, it's not just talking about the heart. We worry about stroke. Okay, so heart disease, stroke, and I also mentioned earlier it predisposes to diabetes, type 2 diabetes, and type 2 diabetes comes with its own complications. So you've got macrovascular and microvascular complications. Macro means big vessels, so your stroke and your heart. Microvascular is your other organs. So your eye, retinopathy, your nerves, neuropathy, and your kidneys, nephropathy. So you want to make sure you don't get all of this. If a person has metabolic syndrome, they have a twofold increased risk of getting cardiovascular disease. So it is very serious.
Yeah,
Okay?
like it's like.
And also, not just the cardiovascular disease, even in terms of mortality, I mean death, it increases your risk of death. So that's the main reason why we need to make sure that you identify and you manage this condition.
So it's like metabolic syndrome has its own different sets of complications that could increase your morbidity and mortality.
Correct. Yeah.
And also increase in your risk of getting other health conditions
Yes.
that we, as Malaysian, we wouldn't like to have, like diabetes. Like everyone is saying diabetes, obesity.
Yeah.
I think we as Malaysian that we heard a lot like I don't want to get this
Yeah.
because it's very hard for us to take care of ourselves, and even to other people who are staying close to us to take care of, like let's say diabetes patient, obesity patient, because they have to visit because it's for what I know it's a long-term
Correct.
disorder. Then you have to revisit the
Yeah.
hospital for re-checkup or like getting medications and all sorts of very inconvenient things.
Correct.
Yeah, so I think we have learned a lot today, and once again we'd like to thank Dr. Subah for joining us for today's podcast. And before we end, we have prepared a very small appreciation gift for Dr.
Thank
Subah.
you very much.
Okay, so although today that we say that sugar is like
Oh dear.
sugar is like will be causing one of the metabolic syndrome, but once a while
I
having
won't say no to this.
nah, you won't say no because it comes with happy hormones. Help us to release happy hormones. Okay, so this one is like a small appreciation gift for us.
Thank you.
Yeah, so you can see there's your name is written on it.
Yeah, thank you so much. Yes. Thank
Okay,
you.
this is a chocolate.
Yeah, thank you.
Okay.
And I also really like to thank you all for
Mhm.
inviting me, because this is a very, very important topic, and with the rising prevalence,
Mhm.
I think the public need to be aware of this.
Mm.
Really need to be aware.
I
Do
agree.
something about it, not just be aware. Including myself.
Mm.
I mean, I'm talking about it, but I don't practice what I preach. So, okay.
So it's like very important for us to take action and to prevent all this instead of just if we know the knowledge and we know what are the steps, but if we are not taking any actions to complete the steps, then nothing is going to change.
Correct.
All right.
Okay.
Thank you, Doctor, for
Yeah,
sharing.
thank you.
And before we end, we would like to say that we have learned a lot about metabolic syndrome today, and if you have any questions or inquiries or any comments you would like to know more about, maybe you can leave your comments in the YouTube channel or in our Instagram, AMSA UTAR, AMSA UTAR, or you can go to our YouTube channel on call 36 and leave your comments below. Okay, so once again, thank you, Doctor.
Thank you.
And building bridges, sharing dreams, Viva AMSA.